My name is Jeremiah Fioravanti. I'm the president of the Delaware County Institute of Science. My professional affiliation is with Harrisburg Area Community College. I'd like to welcome you all to our second virtually presented 2021-2022 lecture series. This is no small feat for an all-volunteer organization founded in 1833 with a building from 1867 in the heart of downtown Media, Pennsylvania. I want to encourage you all to become members and get involved and volunteer at the Institute or donate to our Institute to ensure the long-term sustainability of our organization. I'd like to thank Dr. Gurton of Penn State for setting up this lecture series and Dr. King from Drexel University for providing technical support. Our next speaker will be on November 8th. It'll be the Next Generation Space Telescope, the Next Astronomical Revolution by Dr. Timothy Lauer. At this point, Dr. G, would you please introduce our speaker?
I will do that in just one moment. I do want to take this opportunity first to welcome everyone to our second virtual lecture series. This is quite a feat for the Institute, but what a wonderful opportunity this has been for us to be able to bring speakers in from all different locations across the United States to hear about their expertise. And what I'd like to do quickly is just share with you, even though you got a little bit of a hint, the promo of who is coming up next. We welcome, I mean, what a way to kick off tonight. And I think you're really going to enjoy everything Dr. Johnson has to say. I think all of us are really interested in what she has to share. As you had heard, our next speaker is Dr. Timothy Lauer from Penn State Brandywine, who is a huge fanatic of the James Webb Space Telescope, which is launching in December now. It was going to be launched by the time we had him scheduled to speak. It's been postponed a little bit, but we're going to hear some amazing information about what is next for what we have to learn about space and what James Webb can show us. So that will be our November speaker. Our December speaker, I am thrilled to bring Dr. Kimberly Wood, who is from Mississippi State University. She is a tropical meteorologist. And as hurricane season officially ends November 30th, although we do know we can get hurricanes outside of that time frame, she's going to give us a recap of what happened this year in the North Atlantic for the hurricanes of 2021. So that should be a fascinating lecture for us as well. And as you can see, you can register for Dr. Lauer and Dr. Wood's webinars already. Their links are ready to go. Just confirmed, I am thrilled to share that for January, we'll be kicking off 2022 with a speaker that has spent several years with the Smithsonian's National Museum of American History. She is a mathematician coming to us from Eastern Michigan University. Dr. Amy Sheldelish will be talking about the mathematical devices in the Smithsonian's archives. So for those of you that are especially interested in the intersections of science and history and math, of course, this should be a fascinating tour of what's going on behind the scenes at the Smithsonian for math. In February, we are welcoming Mr. Russ Lasco, who has recently published a book on the geology of Costa Rica. So he is a local person, but has done amazing field work in Costa Rica. And so we look forward to joining his adventures there. Our March speaker is another math person. Dr. Melanie Fraser will be joining us. Her specific topic she is still working on. She is hoping to make this an interactive lecture to challenge our mathematical minds, actually. So this will be a little different lecture for us. And if you notice the date, March 14th, that's 3.14, which is Pi Day. So certainly a math speaker is appropriate for us to have then. Then we'll be moving on into April, where we have Amy Mawby, who is with Jenkins Arboretum, and hopefully we will be in springtime with lots of flowers in bloom. So she is going to be speaking to us about native spring and ephemerals, which will be great. And keep your fingers crossed for me that we can get this last lecture going, especially because I'm involved with it too. I am an oceanographer by training, and hopefully I will be out to sea. My research expedition has been postponed a couple of times, but hopefully I will be coming to you through Zoom from the middle of the South Atlantic Ocean. And I'll be able to take all of you on a live journey with me as we're at the Mid-Atlantic Ridge, sampling from some of the sites where we first sampled the ocean crustal material to prove the theory of plate tectonics. So I'm super excited about that. The link for the lecture series will be appearing. Hopefully it's in the chat and you can see that right now. So if you want, bookmark that definitely so you can take a look at that. And from there, you can also link onto the Delaware County Institute of Science website. So hopefully I've generated a spark of excitement and some great lectures for you to tune into. I'm excited about this collection of speakers, but could not be more excited tonight to present to you Dr. Denise Johnson. Dr. Johnson is the acting physician general in Pennsylvania. Prior to serving this role, Dr. Johnson was more recently the chief medical officer at Meadville Medical Center. Before joining the medical center leadership team in 2008, Dr. Johnson spent 13 years in private practice. She is board certified in obstetrics and gynecology by the American Board and is a fellow of the American College of Healthcare Executives. She's a former commissioner of the Governor's Commission for Women. Dr. Johnson has been involved in various community and regional groups focusing on diversity and inclusion and on the needs of women, and is the former board chair of the Meadville Area Free Clinic. She is past chair of the board of directors of the Pennsylvania Coalition Against Rape. Dr. Johnson, we are thrilled to have you join us this evening, and I turn over the Zoom room to you.
Thank you very much, Dr. Gerton. I am very honored to be within this esteemed company, and hopefully we'll take a little quick tour around COVID-19, and I'll get a chance to take some questions. So I'm going to start by sharing my screen, and someone just let me know that you're all able to see it.
Yes, it's coming through just fine. Thank you.
Great. All right. Well, thank you very much. So we will start off. Hopefully I'll be able to advance this. Okay. All right. Okay, so we're going to be starting off just talking a little bit about COVID-19. And as many of you are aware, coronaviruses are pretty common. We have a lot of them circulating, and some of them cause the common cold, but there have been a couple of coronaviruses that have caused more severe illness and that have been of concern. I don't know how many of you remember SARS, which was severe acute respiratory syndrome that was circulating starting about 2002. Really, by 2003, we really had the peak of this. This was found in about, maybe about 24 countries or so. And I think at most, there were about less than 9,000 cases worldwide, and no cases since 2004, but caused severe respiratory illness that we had not seen before. The next the next coronavirus that was a concern was the Middle Eastern respiratory syndrome, and that was around 2012. We saw this in up to about 21 different countries. Again, really severe respiratory illness. This one seemed to be a lot more deadly than the SARS virus, which came before it, but really tapped out at probably less than 3,000 cases, but a little bit under 900 deaths occurred with it. That was back in about 2012. So fast forward to 2019, and a novel or a new coronavirus was found, and that was the SARS-CoV-2, which causes COVID-19. So I think that we kind of interchange them, and so we don't really refer to it by the name of the virus anymore, but we just call the virus COVID-19. As you recall, this was first identified in Wuhan, China, and this was back in the end of 2019. But goodness, has this really caused quite a different outcome from the ones that we've seen before. I think right now we are up to about 241 million, 47,469 cases of COVID-19 worldwide. There have been more than 4 million, close to 5 million deaths. And then in the United States alone, more than 45 million cases. And as you know, over 725,000 deaths from this new coronavirus. So just a little bit basics of transmission. I think that we learned a lot about this virus over the year and a half or so that we've been, I guess, plagued by it. But we realized that respiratory transmission was a lot more important than we had thought before. So breathing in air close to an infected person, touching your nose or mouth with hands that could have virus on it, all of these important in transmission. But I think what we really realize is that, with colds, we know about doorknobs and touching and sneezing, but this really seemed to have a lot more of a respiratory component. And so that even without touching infected surfaces, being in an enclosed space with someone who was infected, especially if they're talking, singing, coughing, that sort of thing, seems to be a lot more transmission. In Pennsylvania, these numbers are from the last numbers that we have reported today. So Pennsylvania alone, we have 1,513,332 cases of COVID that have been reported. We've had 30,523 deaths, and over the weekend, we've had 11,000 plus new cases. For the past couple weeks, it seems like we've had 4,000 to 5,000 new cases a day. So those numbers are still up there for us. Right now, we have almost 3,000 people hospitalized. The fair number of those are in the ICU or on some sort of ventilatory support. So looking at the kind of graph of our cases, most of you remember that over Thanksgiving through the New Year last year was when we had our highest peak of COVID cases. We did have another peak in the spring, around April. And then we were all celebrating and rejoicing that our case levels went down. We were down to probably around 200 cases a day. But with the onset of the Delta variant, those numbers really ticked right up. And now we have surpassed that spring peak that we had. And we are hoping that we're close to a plateau, but we certainly aren't yet decreasing. Some of the things that we've seen, especially now with the Delta variants, is areas that are that have lower vaccination rates have really ticked up in cases, especially in the adolescent population. Early on in the pandemic, people who were over 65 were prioritized in vaccinations, and though that group was the earliest highly vaccinated group, but we saw then that the cases just shifted to the younger population, and so we were seeing more cases in younger individuals since that older group was highly vaccinated. We talk about the Delta variant. What we found during this pandemic is that the Alpha variant, which was first identified in the United Kingdom, came to the United States and became the predominant variant. But as the Delta variant came on the scene, Delta variant was first identified in India. And we had seen all the news reports of that causing tremendous number of cases and deaths in that country. I think really brought home to us that anything that's happening, especially with this pandemic, anywhere in the world is something that can affect us. I think that many times in the past, we felt really isolated when these cases have been going on. I think even with the first SARS and with MERS, I think we didn't really think of it as so much our problem, but certainly with this pandemic, we've seen, whatever we're seeing across the globe is eventually going to come to us. The Delta variant is much more highly transmissible than the original virus, and certainly even more than the Alpha variant that we saw. One of the characteristics of the Alpha variant was that it was more transmissible than the original virus, but the Delta variant was much more transmissible. And so once Delta came on the scene, it really, because of its highly transmissible nature, it really outcompeted all of the other variants that we have. And right now in Pennsylvania, I think we're probably about 99+% Delta variant. So, you know, there are some other variants circulating, but in very, very small numbers because the Delta is just so much more predominant. So switching gears a little bit to talking about prevention, prevention strategies utilize several different components. So I think that we need to think about things that can decrease your risks, and adding more and more onto that, decrease your risk even more. So, you know, obviously things that increase your risk is being in an area that has a lot of transmission, one of the high transmission areas, especially indoors where there's less ventilation, you're close to other people, and you're unmasked. All of those things are going to increase your risk for contracting COVID. Things that will decrease your risk, obviously, would be being outdoors, so having more ventilation, more space between people, and wearing masks will decrease the amount of virus that is transmitted, and so decrease your risk of contacting the virus. So really prevention is around certainly immunization, but also just kind of the general hygiene, your cough and sneeze, covering it, wearing a mask when you're in public, and making sure you have good hygiene, and then as much distancing as possible. So again, prevention of transmission, vaccination, masks, certainly staying home if you're not feeling well. I think in years past, we thought it heroic if we went to work or went to school when we were ill. We thought we were, you know, doing something great. But I think now, knowing transmission of not only COVID, but other diseases, I think now we rethink that strategy. And then, you know, staying away from crowded spaces, especially spaces where there are unvaccinated people, avoiding those crowds and poorly ventilated spaces, and just practicing good hygiene. So switch gears a little bit to vaccinations. Right now, we have 3 vaccinations approved in the United States for COVID-19. So there's the Moderna, the Janssen, and the Comirnaty, which is the Pfizer, which has that name change after getting the full FDA approval for their primary series vaccine in the 16 and older population. So just a couple of points about vaccines. Vaccines are safe and effective. We have given already more than 300 million doses of vaccine, and so have tremendous amount of data that we've never had before for anything really, to see how safe and effective they are. Certainly when people get vaccines, there are side effects. And so that, you know, really want to make sure that, you know, someone who is hesitant about getting a vaccine to know that, yes, it's normal for your arm to be sore. It's normal to have fevers or chills or feel achy after that vaccine. That usually lasts for just a couple days or less and goes away. And it's a symbol of your immune system working. In those 2-dose vaccines, often with the second dose, you may feel even more side effects because that vaccine is meant to boost your immune system. There have been some serious side effects seen. Those have been rare. Obviously, there have been concerns with the mRNA vaccines, which are the Pfizer or the Moderna, of the inflammation of the heart muscle, seen more commonly in young men. that condition is still rare, and it has most of those cases, or almost all of those cases, have resolved with minimal treatment, rest, and an anti-inflammatory like Tylenol. And most of those cases resolve. And important to know that someone who gets COVID has a much higher chance of getting that condition from the actual COVID. The other concern had been the blood clots, seen more in women with the J&J vaccine. The blood clots were unusual because most times when people get blood clots, we tend to treat them with an anticoagulant. But in these blood clots that patients had, they were found to have low platelet counts. And so low platelets need to be treated a different way. And so providers needed to be alerted, healthcare providers need to be alerted to make sure that they were giving the correct treatment. Again, these cases are really quite rare, and the vaccine or the virus causes a tremendous number of blood clots. In fact, some of the treatment protocols for patients when they have COVID is to start them on an anticoagulant because of the high risk for blood clots. So again, millions of people have safely gotten the vaccines, and we have seen that in areas and where people are highly vaccinated, those case rates decrease. And then remember that the vaccines also were intended to prevent severe illness and death, and so that they really have been outstanding in that regard. So just about Pennsylvania, so far we've had over 13 million vaccinations administered. Pennsylvanians above age 18, we've got more than 70% of them fully vaccinated. And vaccination rates are varied across the Commonwealth, something that we really closely monitor and work on increasing vaccination rates in the areas where they're a little bit lower. As many of you heard, there are some additional doses that have been authorized. The first one is a third dose for people who are immunocompromised. So there are some individuals who, because of their medical condition or treatments that they're undergoing, they do not mount a full immune response to vaccines. So this may be patients undergoing some cancer treatment or having some abnormality of the immune system. For these people, a third dose of vaccine has been authorized for those who got one of the mRNA vaccines. So that would be the Pfizer or the Moderna. And so this third dose is authorized for anytime after 28 days after they got their second dose in the series. There also has been a booster dose that has been authorized for people who got the Pfizer vaccine. We have seen in especially the over 65 age that over time there is some waning of the immune system. And for that reason, the booster dose has been authorized for people who are over age 65. Also, other people who are in high risk for COVID because of their underlying condition or because of where they live or work. So people who are in a congregate setting are authorized to have that booster dose. And then people who have an underlying condition that puts them at risk, or people who work in a high-risk occupation that put them at risk, such as frontline healthcare workers, are authorized for a booster dose as well. So just a reminder, though, that even though the booster doses are authorized, our main goal right now is to get more people their primary vaccination. We still are seeing that the people that are hospitalized or in the ICU or on ventilators are more people who have not been vaccinated. And so that the vaccination still protects quite well against severe illness and severe illness and death. So we are seeing, though, that more people that are hospitalized have had the vaccine. And so remember that we need to really look at it as more people get vaccinated, there will be more people that have COVID that have been vaccinated. Remember, the vaccines were meant to make sure that we protect against severe illness and death, but the vaccine cannot prevent every single infection. Especially with the Delta variant, we know that that is highly transmissible. We've also learned that individuals who contract COVID with the Delta have a high viral load. So they have a lot of virus that's circulating within them. People who are vaccinated, though, will tend to clear that virus quicker and also clear the virus without being severely ill. But we also, an analogy that we use quite often is that many years ago, wearing seatbelt was not very common, and we had a lot of traffic accidents that were fatal. Once we had more people wearing seatbelts, we saw a lot more car accidents that occurred with people wearing seatbelts. But it's not that the seatbelts didn't work. We knew that even though there were more car accidents with people wearing seatbelts, the fatalities went down dramatically. And so with the vaccines, we're protecting against severe illness and death, but we're not protecting against every infection. And remember, no vaccine is going to be 100%. People have all kinds of medical variability that make them more or less susceptible, but it has made a significant impact in decreasing our cases and certainly our deaths. So in Pennsylvania, the cases that we've seen after vaccination, we've noticed that cumulatively from January to mid-October, 91% of our cases, 93% of our hospitalizations, 93% of our deaths were in people who were not vaccinated. As we get further along in this pandemic, with the Delta, with the waning immunity, we have seen that we have more cases in people who have been vaccinated. Right now, about 74% of our COVID-19 cases are in people who have not been vaccinated. So still the majority of patients who are ill and in the hospital and with COVID cases are those people who have not been vaccinated. So just a word about vaccine mandates. I know the federal government has made an executive order for vaccinations for federal contractors and subcontractors and companies with more than 100 employees. Those are still sort of in the rule-making progress. They've not really come fully implemented, but that's certainly something that we can expect. For nursing home employees, again, it was announced that the vaccination will be required for them. And the CMS, or the Centers for Medicare and Medicaid Services, funding can be jeopardized by not having the vaccinations. We know that in the nursing homes, we have a vulnerable population, and for the nursing home outbreaks that we've seen, they have primarily been staff members who contracted COVID outside of the facility, and then that virus spread within the facility. Those residents of the facility aren't able to go other places, and they're vulnerable and sort of a captive population. And so there has been a requirement for vaccines. For state employees in the Commonwealth, those who are taking care of patients in healthcare or in a high-risk congregate setting, such as a correctional facility, again, vulnerable populations that are captive, aren't able to leave, and are at risk of becoming infected because of infections that occur outside of the facility. Oh, goodness. So that's just my quick overview. I will pause here and take any questions that you might have.
Thank you so much, Dr. Johnson. And yes, we do have questions. So as a reminder to audience members, please click on Q&A at the bottom. We already have a question that's in there. So if you do have more, but I think let's go ahead and start with the questions that came in with the registration form. So some people that registered already submitted questions, and we have a couple relating to the Delta variant, if we can start there. One of them is, should the public anticipate the Delta variant of the COVID-19 virus to be the predominant strain this winter season?
Well, it's hard to predict how long that will last, but right now the Delta variant is 99+% in Pennsylvania. So it really would take a variant that is much more transmissible to kind of displace that variant. It certainly could happen, but you know, we haven't seen something emerge. I know there's the Mu variant that there, you know, is some concern, but so far in the areas where we've seen it, it's been a very, very small number, and it's just been way overshadowed by the Delta.
And do we know what makes the Delta variant more transmissible?
Well, I think several factors. Some believe that it is a little stickier, so it can adhere to our cells more, and so you know, easier to transmit. But also, it multiplies quickly, and so that people tend to have really huge viral loads, so that you can spread to a lot more people in a shorter period of time.
Okay, we have some questions about masking and such. So specifically for us here in Delaware County, what should we be doing about mask wearing in Delaware County?
So the CDC recommends that in areas of substantial or high transmission, that people wear masks in indoor settings. So those are people who are vaccinated or unvaccinated. If you're in an indoor setting, it's recommended to wear a mask. So far, Pennsylvania, I think all of our counties are either substantial or high. So I think that guidance still pertains to all of our counties.
And to follow up on that with a question that's appeared in our Q&A, how safe is it to be in an indoor office where everyone is vaccinated but not masked and not always distanced?
Well, I think that, you know, there's certainly degrees and nuances to it. If people are fully vaccinated, especially if you're having like your family get-togethers, right? Everyone's fully vaccinated. I think that you can feel comfortable being in an indoor setting with them. That being said, people who are fully vaccinated and also engaging in other activities with unvaccinated people will have some more risks. So you really have to look at your risks. Certainly with your household members, people vaccinated, you know, you sort of know what sort of activities they engage in, but again, if people are in other situations where there may be high transmission, they will have some risk.
Thank you. And you touched on this earlier, but maybe you could just recap. Will immune compromised individuals eventually need a booster?
So I think hard to say because, you know, we still are looking at the data and looking at how long the immunity lasts. The immune compromised individuals, I think that the data shows that after those 2 doses of the vaccine didn't seem to mount a good immune response. But with the 3rd one, I think that at least some studies that we've seen show that it looks like they have an adequate response. How long that lasts, I think we really don't know. We need to have more studies to see.
Okay, and this is the last question that I have. So if anyone else has any questions, please, this is the chance to get them into the chat. This one came in again ahead of time on the registration form. How does Pfizer's COVID vaccine with only 30 micrograms of the main ingredient compare to Moderna's 100 micrograms?
Well, I don't think we can compare it that way, just because, even though they both have the mRNA technology, they're just made different ways. And so that, it's like, aspirin or Tylenol, the doses are different because they're just different formulations. So I don't think that we can compare just a microgram basis for that. The key is that the antigen that the vaccine contains stimulates your immune system. When they're doing the clinical trials, they also do not only to make sure that you have an immune response, they also do a dosing trial. So they usually check several doses to see what will give you the best immune response. And it may be that a lower dose is going to stimulate the response that you need. And so they give you the lowest dose that will stimulate the adequate response. And that can be different for different antigens. So not a way to compare apples to apples from one vaccine to the other. Just want to make sure that you get an adequate immune response, whatever dose is determined.
Okay, we have some more questions that are popping in, and Dr. Johnson, I hope you brought your crystal ball with you because this is asking about the future now. So should we expect more epidemics of this sort in the future, or are these once in 100-year things?
Well, I certainly don't have a crystal ball for that, but I think that, we've definitely learned some lessons, right? And I think, as I mentioned before, I think we've really used to feel very isolated here in the United States. And, we'd see these outbreaks around the world, but not really been concerned about it. So I think we really need to know that anything that happens around the world could impact us. And so that, we need to be prepared and we need to be proactive when we see these things occur. Hopefully there's some lessons learned from this pandemic, and so that we will shore up our systems in terms of public health, in terms of surveillance, in terms of prevention strategies, so that we can mitigate the effects of another pandemic. But again, we are a global society now. Everyone's moving around, and so that we definitely have potential for these things, but hopefully we've learned some lessons that we can, make it not as big a deal as this has been for us.
And that ties in very nicely to the follow-up question that was asking, will we be better prepared if or when this happens again? And also, how prepared were we in the world for this pandemic to begin with?
Well, I think, certainly there are things that we had in place, but I think that we were all in a state of denial because no one ever would have thought that we could be in a situation like we are now. In terms of the vaccine development, I think that there are a lot of things that we had in place that really made that happen quickly, right? So that for the Johnson & Johnson vaccine, which is a viral vector vaccine, we've been doing that for decades. And so we had that down, we knew how to do it. For the mRNA vaccines, the Moderna and the Pfizer, we had that platform. We've been working on that for a decade. And the sequencing, I think I've told others that when I was after college, I worked in a lab doing DNA sequencing. And back then, we sequenced a little tiny piece of DNA, and it took us like 3 days to do it. Now, with the coronavirus, by January, we had the whole sequence of that viral genome, and that's about 30,000 base pairs. I was doing 10 at a time, and that took days. So, we've had some significant technology that gave us the ability to get vaccines, because I think, no one thought that we could get vaccines that quickly, but we had all of that in place. So there are a lot of things that we have in place, but I think that in terms of being coordinated in our response. I think those are lessons that we can learn for the next pandemic.
Great. And again, one more shout out. If anyone has any questions, to get them in the Q&A. This is the last one we see posted. I'm surprised at how short the immunity lasts with COVID. Is this unusually short, or is immunity to things like chickenpox shorter lived, a few years rather than decades than I had understood?
So I think that knowledge is still evolving because, we certainly have seen some waning immunity, but, still at this time, even with Delta on board, the vaccines are protecting quite well. I think that some are arguing that there are probably only small subpopulations that need to have that additional boost, whereas the vast majority of people have really good protection. But again, we're still learning, and it's so hard to tell. Yeah, I think we just need more information, more data, and we need more time to see how long the immunity will last.
And so at this point, will we now be able to come up with vaccines for other diseases?
Absolutely. I mean, I think that the mRNA platform is really exciting because it's really kind of plug and play. We've got the platform, we just need to get the sequence, and then we can, we can make it in a short period of time. So I think that is really exciting. Even the viral vector vaccines, I think that, being able to sequence and to be able to synthesize those proteins, it's just amazing. There are a lot of technologies that we've, got in our toolbox to be able to make vaccines. And I think it's not only, to these infectious diseases. I think that the technology is going to give us some more tools in terms of cancer treatments. I think already we've been doing some work with some inherited disorders as well. So it has a broad range of applications. And so, we've really spurred on some of that research and moved it along. But I think that we'll see a lot of developments come out of some of the great work that our scientists have been doing.
I think this is a follow-on from that. Someone asking is it the case sometimes where maybe there's not enough people getting sick from these diseases to make it worthwhile for the pharmaceutical companies to invest in vaccines? They mentioned they're thinking of some of the tropical diseases, perhaps.
Yeah, I think, certainly, especially with these COVID vaccines, one of the reasons that we're able to get things moving along so quickly is the tremendous amount of funding, right? So that for a lot of developments, companies have to do the work as they can afford it. They don't just have tons of money right up front to be able to do that. And then, of course, I think that companies or businesses, and so they want to do something that will be, have quite a return on the investment. So for those things that, may not be as, I don't know, exciting, I think that, it's up to us to provide some public funding to make that work. So yes, I think that there are definitely diseases that are not going to get as much attention because, they're not, as profitable or as widespread, but, still very, very important.
So the last question I have for you is what do you hope each of us takes away from your talk tonight? What is the take-home message or the message you would like us to share with others?
Well, certainly, I think all of us want to get past this pandemic, right? I think that, our appetite for it is gone. We really want our lives back. And we want to start doing the things that we did before. We used to go over to friend's house and have dinner. We used to go visit our elderly. We used to go to the hospital to visit the sick. We haven't been able to do all of that. So we know the vaccines are safe and effective, and they can get us out of that. They could get our businesses back up and running. They could get us, back to our real lives. So, I hope people realize that. And if they need information about vaccines, talk to someone who has been vaccinated, talk to your healthcare provider, but let's just get our lives back. We're tired of this. All of us are tired of this.
Agreed, but we are not tired of getting good quality, scientifically sound information. And Dr. Johnson, you have provided that for us tonight. Thank you so much for your time and all this wealth of information. Jeremiah, I'll turn it back over to you.
Well, thanks. It's been my pleasure.
Thank you so much. I'd like to thank everybody for coming this evening. It was a really informative talk. So thank you very much. The local media population, the news media, the people from the greater Pennsylvania area, and even beyond. I'd like to thank everyone for coming. I'd encourage everybody to come back on November 8th and participate in our next virtual lecture that we have. This one will be taped and posted somewhere, which is a first for us. So thank you, Dr. Johnson, for agreeing to that. And I'd like to thank you again one more time for coming. Everyone have a wonderful night. Stay safe, pay attention. Let's get back to normal as soon as possible. Thanks again.
Thank you. Have a great evening.